I was interested in the presidential plenary lecture because it brought up an issue that has been neglected, which is burnout among neurologists, which was which was quite surprising in terms of the number of people who have symptoms, who have signs, evidence of burnout, which is all up to about 60%, more so than many other medical disciplines. And there are some areas in which we neurologists are doing the poorest of all the specialties. So that was an eye-opening, interesting talk. And there was towards the end, there was some ideas about how to deal with that, how to cope with that, how to try to prevent that. So hopefully something will be done about that. But it was it was very interesting. And of course I heard some other talks, but I was impressed by that lecture. So I've heard two talks back to back about using spinal cord atrophy, which is beginning to be more and more used in clinical trials. So far it's been used very little, in particular in a longitudinal way in people with MS. We did that already for a number of years. So I found it very interesting that people are now beginning to look and are beginning to see it as an additional modality that provides more information or additional information to the standard imaging of brain atrophy. So one was dedicated specifically to gray matter atrophy in the cord, which is also very interesting, and some correlations with disability. So I found those interesting, and there are some talks linked to efficacy of drugs, for example, alemtuzumab. There was a study showing that the reduction in the brain atrophy rate, even in people who only had two courses of, so year one, year two courses of alemtuzumab, then stabilized. This reduction in the progression of brain atrophy was sustained at 7 years after the treatment. So again, one more piece of evidence for the efficacy of alemtuzumab. So, and then I'm sure there will be a few other interesting imaging talks done throughout the course of the meeting. So. Ocrelizumab, which is a B-cell depletion therapy, which has received a lot of interest recently because there were two well-done clinical trials in both relapsing remitting and primary progressive MS, which showed efficacy. And for primary progressive MS, it's the first treatment really that showed a positive effect. So it's going to be something that we're going to hear more and more about. And it seems that also from the immunological point of view, and there was a number of posters making it quite attractive to target B cells in MS. One was about supernatants from B cell cultures are toxic to oligodendrocytes, and it turns out that it was the exosomes of these B cells released that are toxic. It's unclear what they produce, but so it seems to be that more and more people are looking at the role of B cells in MS. We also have modalities to deplete them with the new monoclonal antibodies. So I think it's something that we're going to hear more and more about and do more and more research about in MS.